Yeah.
Good morning.
Good morning.
My name is Rose Stacy Bebeles. I am a nurse clinician here at the Obstetrical Shibata Nurse Miguel Health Clinic. How are you doing?
I'm good, thank you.
May I sit?
Of course.
Okay, thank you. All right, so today I will be asking you some questions pertaining to your current health situation. I will also ask questions about your medical health history as well as your health habits. Okay. If at any point you feel that you're uncomfortable and do not want to answer a question, just let me know and then we'll skip to another one.
Okay.
Okay. Do you have the permission to continue?
Of course.
Very good. You may also notice that I don't necessarily always look at you because I'm taking notes from what you're saying.
No problem.
All right. May I start by your full name, please?
My name is Tanya Jean.
And what is your date of birth?
July 25th, 1991.
And what pronouns do you use? For example, I use she and her.
Same thing, she and her.
And tell me, Tanya, can I call you Tanya?
Of course.
All right. Tell me, Tanya, who can I put as your emergency call?
You can put my husband, Jérôme Jean.
Jérôme Jean. What number?
514-349-7609.
7609. Okay. And what is your occupation, Tanya?
I'm a high school teacher.
And tell me, what brings you here today?
I have some back pain. It started a week ago and it's just getting worse.
It's just getting worse. Okay. So now you'll hear me asking you questions to better understand the nature of your pain, okay? When did that start? You said a week ago?
Yeah, exactly.
Okay. And is it a constant pain or intermittent?
It's constant.
It's constant. And how would you describe that pain?
It's like a sharp pain.
A sharp pain.
Yeah.
And tell me, on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you've experienced, how much is the pain right now?
I would say a good 4 on 10.
Good 4 out of 10. Okay. And what makes the pain worse?
Everything. Walking, sitting for a long time, taking care of my kids, doing any house chores at home.
That's not fun, eh? How much would the pain be at its worst?
I would say 6 on 10.
And you just said that it prevents you from doing, taking care of the kids, doing house chores. How else does it impact you?
Well, I had to take 2 days off from work. I went back because at some point I need to work. I can't use all my sick days, but even at work, everything is difficult. Everything that I'm doing.
I'm sorry to hear that. And I'm also noticing a bit of a scooped position. Yeah.
It's just, I feel more comfortable like this.
Okay. And can you tell me how this pain impacts your mobility?
It's difficult to bend forward. It's difficult when I'm walking, even stretching.
Okay. I understand. And tell me, what makes the pain better?
When I rest, when I can. And sometimes I take Tylenols.
Okay. Tylenol, what is the dosage you take and at what frequency?
Well, I take it twice a day and I take 2 pills.
2 pills twice a day. And when was the last time you took it?
This morning.
This morning. And you said 2 pills. Is it regular, extra strength? Do you know?
I think it's regular. And I just, I follow what's written on the bottle.
Okay. And at the best, you said that the pain is?
I would say a 2 on 10. Let's say an hour after taking Tylenol, it's a 2 on 10. But see now, it's already back to 4 on 10.
Okay, I understand that. And you said that the pain was located at the back.
Yeah.
Right? Does it go radiate anywhere else?
No.
No, to the legs?
No.
Nothing. Okay. What is your understanding of that situation? What happened?
Well, when I went to the high school where I'm working, and we were moving some stuff around, and I lifted some heavy boxes, and I think I might pinch a nerve or something muscular, it's probably muscular pain. I don't know, I hurt myself.
Okay. Well, thank you for answering that. So we'll be able to understand better. I will ask more questions to probe. Now I'm going to be asking you questions specific to your past medical health history. Okay. Before we go into that, do you have any other symptoms like fever and numbness in the legs?
No, it's really just the pain.
Okay, then let's go to the past medical history. Thank you for answering. Do you have any allergies to medication?
No.
No allergies to medication. Very good. Do you have any allergies to environment?
No.
No. Any allergies to food?
Yes, I'm allergic to peanuts.
Okay. And what is the reaction you get?
The last time I ate some peanut, I had like a full body rash.
Okay. And what is the treatment you take for this allergy?
I have my EpiPen.
Do you know how to use it?
Yes, it's blue to the sky, orange to the tie.
Very good. And do you wear a medical alert bracelet?
No.
No. Well, if you want, after the end of this interview, I can let you know a bit more about what that is, and if you're interested, we could actually provide you one.
But yeah, sure.
Okay. All right. Now, other questions. Bear with me. Have you ever been diagnosed with a chronic illness such as diabetes, hypertension?
No.
Have you ever been diagnosed with any communicable diseases, that is tuberculosis, HIV, hepatitis?
No.
Have you ever had any injuries or child accidents in the past?
I broke my arm at the age of 12.
Okay.
Yeah.
Were there any complications?
No.
No complications. Have you ever been hospitalized before?
Yes, but only when I had my children.
Have you ever had any surgery?
Again, like last year, I had a C-section for my daughter.
Okay. Were there any complications to that?
No.
And talking about children, how many pregnancies have you had?
3.
3 pregnancies. How many children do you have?
3.
3 children. Okay. And how old are they?
I have a 5-year-old boy, a 3-year-old boy, and my daughter, she's a year old.
Oh wow.
A year old. Sorry.
Okay. Congratulations.
Thank you.
Have you ever had a miscarriage or an abortion?
No.
The children, were they full term or premature?
Full term.
I understand you just said that you had a C-section for one of your children.
Yeah.
Did you have vaginal deliveries?
So yeah, my daughter last year I had a C-section, but for my 2 boys it was vaginal deliveries.
Okay. So again, since we're talking about children, let's branch off to the family planning questions.
Yeah.
Are you sexually active?
Yes.
How many partners have you had in the past year?
Only one, my husband.
Your husband. Okay. Are you monogamous?
Yeah.
Do you use any form of contraception at the moment, or are you planning on having many other children?
We're using condoms because I think the family is complete.
It's complete. Okay. When was your last STI screening?
Probably, 2 years ago when I was pregnant.
Okay. And when was your last menstrual period?
2 weeks ago.
2 weeks ago. How many days is it?
28 days.
Is it regular?
Yeah.
How would you describe the flow?
Normal, like not too heavy, not too light.
Very good. And when was your last pap test?
Again, 2 years ago when I was pregnant.
That's very good. As you know, the pap test is every 3 years. Therefore, you're within the nice time frame. Do you take any prescribed medication?
No.
No. Any over-the-counter medication apart from the Tylenol you just named?
Sometime Advil,
Okay.
for headaches or things like that.
Okay. And for the Tylenol, you had mentioned 2 pills twice a day. That's the correct dosage and frequency?
Right now, yes.
Okay, perfect. You mentioned that you were are you taking any herbal medication or vitamins?
I take vitamin C.
What's the dosage and frequency?
I take it every day, but again, for the dosage, I just follow what's written on the bottle. I always do that.
Follow what's written on the bottle. That's a safe bet. Do you have any, or have you had any childhood illnesses?
I had chickenpox,
Okay.
probably around the age of 5 years old.
Okay. And are all your immunizations up to date?
Yeah, they are.
Yes, they are. So we're talking tetanus, influenza, and more recently COVID.
Yes, I have all my vaccines.
Okay, very good. Just wanted to clarify. When was the last time you saw a doctor or a nurse practitioner?
Last year, after I gave birth, yeah.
Okay. And did you recently travel outside of the country?
No.
Yeah. Perfect. Thank you. So now I'm going to ask you questions about your family history. It will require that you remember, and if you don't have that information, it is okay as well. So this will allow us to do prevention for any genetic diseases or maybe understand better what is happening to you. So now I'm going to ask you to recall past 3 generations. So that is you and your siblings, your parents, and your grandparents. Were they or are they suffering from any of such diseases such as high blood pressure, diabetes, cancer, asthma, or heart disease?
Well, I have 2 sisters. They're healthy. And then my parents also, they're healthy. Nothing there. On my mother's side, I think that one of they're both deceased, my grandparents on my mother's side, but I think one of them had diabetes and high blood pressure. And on my father's side, the grandparents, I don't really know.
You don't really know?
No.
I'm sorry for your maternal grandparents.
Thank you.
Now I'm going to ask you some questions about your lifestyle habit, okay? What is your perception of health, and do you consider yourself healthy?
I think I'm healthy. I have a balanced diet. I'm kind of active when I don't have that back pain. So yeah, I think I'm a healthy person.
Okay, so you mentioned a balanced diet. Are you able to tell me a bit more, maybe describe a 24-hour, what you ate in the past 24 hours?
Yeah, so for lunch, I had like a chickpeas salad. And for dinner, yesterday we had spaghetti with, salad next to it. And for dessert, like a fruit. And I'm only drinking water. And this morning I had oatmeal with like little fruits, like.
Okay, very good memory. Now tell me, does that represent what you usually eat?
Yeah, pretty much.
All right. You also mentioned that you were active, apart from what is happening right now. How do you keep active?
I take yoga classes 2 days per week. And when I'm able to, I use my bicycle to go to work.
Okay. And apart from the glasses that you're wearing, do you use or do you require the use of any other assistive devices?
No.
Do you consider yourself to be a stressed person?
No, not really.
No? Okay, that's good. And so now, if and when you're stressed, how do you cope and manage with that stress? So you mentioned the yoga. Does that help, or do you do anything else?
Exactly. It's the yoga or any kind of exercises. It helps a lot.
Okay, perfect. Are you a religious or spiritual person?
Well, I am Catholic, but we don't really go to church. I believe in God, yes.
Okay. And now, how do you describe your relationship with your family, with your friends?
It's all good. I'm really close to my parents, my sisters. Everything is going okay with my husband, and the kids are wonderful. So
therefore, you would say that you have a good support system?
Yeah, absolutely.
That's good. Are you experiencing at the moment any difficulties such as financial?
No.
Okay, that's good. And now, how many hours a night do you sleep?
I would say probably around 6.
Do you feel rested when you wake?
Yes.
And do you take any naps at all during the day?
During the weekend, but not during the week.
As far as elimination and bowel movement, how often do you go?
Once a day.
Once a day. What is the consistency? Diarrhea, constipation?
No, it's normal, like formed.
Do you have any difficulty urinating?
No.
Still have a few more to go. Bear with me.
Yeah.
Now I'm gonna ask you questions about your alcohol consumption, okay? And tobacco as well. Do you drink alcohol? And if so, in what quantity and how often?
I take like 1 or 2 glasses of wine per week.
Okay.
Yeah.
Okay. And what about smoking?
I'm not smoking.
You're not smoking. Have you ever smoked?
Yes.
When did you stop?
I stopped 3 years ago.
Okay, very, very good. Congratulations.
Thank you.
And how much did you smoke then, and for how long?
Probably for 5 years. And how much? I would say 5 cigarettes per day.
Do you vape or have you ever vaped?
No.
Okay. Do you take any other substances or drugs such as cannabis, cocaine?
No.
Have you ever tried any substances? No. So that's now I have the last question for this particular part. Thank you for your collaboration again. So regarding your home and work environment, any hazards that you've noticed?
Like,
such as chemicals, stairs? No. And you had mentioned that you hurt yourself lifting boxes. Is that something recurrent for your job?
No, it's just we were moving things around, reorganization at school, but it's not often.
Okay.
Usually we keep the same spot, the same class.
All right. That's good. Now, for the last part of this interview, I'm going to ask you specific questions about different systems, body parts, if you want, and then you'll tell me so that it helps me understand a bit better how to proceed with the current health situation. Okay. In terms of your skin, hair, and nails, mostly skin, have you noticed any problem with your skin?
No.
No. Have you been bleeding?
No.
From the back? No. Any rashes?
No.
Not. Very good. In terms of your neurological system, any numbness and tingling in the arms and the legs?
No.
No. No trouble with memory?
No.
No. No gait abnormalities?
Well, I have trouble walking because it's painful, but it's not really about my gait.
Okay, so then the trouble walking would be more with the musculoskeletal system,
I guess.
Then let's ask about that. Any pain, stiffness in the joints, limitation of motion?
No, but limitation of motion kind of, because, as I said, I have like difficulty bending forward. But, yeah.
Okay. All right. So then that completes all the questions I had for this health interview. Now we're going to proceed into the normal course of our appointment today, which is a physical exam, and then we'll be looking to establishing a nursing impression. That is what it is that we need to do and how to intervene to help you better in your situation.
Okay.
Okay. Thank you.
Thank you very